He said something to me first, you know, like, hey, are you okay? And then immediately said, hey, we need to get him some help.
Michael McHugh was in the middle of conducting a job interview when he froze and began slurring his words. He was having a stroke. Luckily for Michael, that job candidate knew exactly what to do. Good morning, I'm Alexis Del Cid. Welcome to All Things Brain Health. Have you heard of the acronym Be Fast? It's a common one for educating people about how to recognize when someone is having a stroke. Michael McHugh is the perfect example for why that is so important. Janine Kiesling shows us.
So, like four sentence.
At first, Mike McHugh couldn't say anything at all.
What's one trip you've not taken that you want to someday?
Now, 3 months after a serious stroke, he's regaining his voice word by word through speech therapy at the University of Kansas Health System.
You are doing so well.
Well, thank you. You're a big reason that's we're doing this right now.
Mike was 47 at the time, working as a sales manager and interviewing a potential new hire when that candidate noticed something wasn't right.
He said something to me first, like, hey, are you okay? And then immediately said, hey, we need to get him some help. After that point, I don't remember until probably 3 days later.
Mike doesn't remember the interview or the candidate, but he credits that person with saving his life.
To get somebody there right away, obviously would thank everyone up and down for that.
After surviving the stroke, Mike is taking steps, literally, to get healthier.
Definitely done a lot more walking. I'm trying to start getting back into some sort of fit.
Doctors discovered the stroke was caused by atrial fibrillation, or AFib, an irregular heartbeat that can lead to clots. His care team is now treating his heart while guiding him through stroke recovery.
Unbelievable, amazing. Everyone cares for you, first of all. That's what's most important.
Mike's progress has been faster than expected. After just a few months, he's talking, laughing, and pushing himself, thanks to the encouragement from his therapist, Courtney King.
They always challenge you, and they challenged me with this, and I kind of took it and ran with it. 3 months later, the fact that I can now speak is pretty impressive.
A moment that could have gone unnoticed, but thanks to one observant job candidate and a world-class care team, Mike is now walking, talking, and living with purpose.
Michael McHugh's doing great today. He wanted to join us, but he's in the middle of conducting more job interviews. So he's a busy guy, back to work. We're so happy to hear that. This morning, we have his neurointerventional surgeon, Dr. Michael Abraham, joining the conversation. And we also have Dr. Deepika Agarwal. Dr. Agarwal is a neurologist here at the health system. She also has a unique story because she's a stroke survivor who has done amazing things for other survivors. We're going to get to that in a moment. First of all, when's the last time you saw Mike?
It was last fall, and at that time he was doing fairly well.
Doing so well, you haven't seen him
Correct,
since then.
correct, yeah.
Is that typical to have that that kind of a recovery?
Unfortunately not. You know, a lot of times when people come, there is already a portion of the brain that has stroked out, so they are left with a lot of deficits. But in Mike's case, he was fortunate when he got here, you know, very quickly, because the person he was interviewing, there was minimal stroke when he arrived at KU.
Because that person knew the signs.
Exactly.
And we're going to get to that acronym. Dr. Agarwal, when did you have your stroke?
I had my stroke in September 2019.
And you had just returned, boy, you had a rough go of it. You just returned after cancer treatment when you had your stroke. So were you here at work? Where were you when you had your stroke?
No, I wasn't at work. In fact, I remember that day vividly, and it was a bright sunny morning, and I was off work that day, so I thought to treat myself, and I went to a restaurant for breakfast alone, with the thought of I'm gonna just relax myself. Who gets a day off during the week? But then as I was enjoying my coffee, I had a sudden onset, terrible, severe headache, which fits into the category of worst headache of my life.
Wow.
And in retrospect, now I think that I should have been able to recognize the red flag, but I was completely oblivious to the fact that I can have a stroke. And I just, since I was nauseous, so I just checked out from the restaurant and went and sat in my car.
So nausea and a headache.
Yeah.
I mean, honestly, I wouldn't have thought that was a stroke right away. That wouldn't have been top of mind. Have you been nauseous with a headache before?
Yeah, that could be a migraine.
Right.
Yeah.
Yeah.
So you get your bill, you go sit in your car, hope to feel better, and then what?
So thankfully, I was texting and texting a friend and a colleague who's also a neurologist here at the health system. For those who know Dr. Brennan Biddle, she's my life saver. And so she knew that where I was and that I was having a bad headache, and she said that, okay, I'll check on you in 15 minutes, take some break in your, go sit in your car, don't start driving. And as I was, she checked on me in 15 minutes, and when she called me, I was slurring my words and not making any sense.
Wow.
So that made her drive to my rescue, and when she found me, she called 911 and
How far
also
did she have to
called.
drive?
So she was at her house in Overland Park, and then I was in Westport.
So she drives over.
So
there.
she drove over, and then when she found me, because she had to find my car in the parking lot, and she didn't know that what kind of car
Oh my God.
I was sitting in. So once she found me, and then I was having a facial droop, so she called 911, and then also called the hospital's stroke team and told them that this is the state I'm in.
How much time do you think it passed?
I think it probably was about an hour or so, yeah.
So, Dr. Abraham, when you hear an hour's time, that's a lot longer than what Michael McHugh had before. He was doing the interview, he was at work, people recognized the signs, called 911. When you hear an hour, does that sound like a long time for you or a reasonable time?
It's still a reasonable time.
It is?
I
Okay.
think so, yeah. It used to be back in the day, some people, majority would be coming in well over an hour afterwards, just because people were not as aware of what a stroke looked like
Okay.
5-10 years ago.
And so to be sitting here next to Dr. Agarwal now, who's practicing medicine again.
Yeah, it's great.
It's incredible. It says a lot about the advancements that have been made. Which brings us to the acronym. We're talking about SPEED. At the top of the program, we talked about Be Fast. Dr. Abraham, can you break down what these letters mean, BEFAST?
Yeah, so the first one is balance. Any acute loss of balance, vertigo, unsteadiness. And then E is for eyes, so any disability or inability to look one way or another, any loss of vision. And then F is for face, so any facial weakness. A is for arm, any arm or upper extremity weakness. S is for speech, so loss of speech, acute onset of slurred speech. And then T is for time. As you said, we need to recognize stroke as quickly as possible.
What is happening in the brain at that moment that makes time so critical?
Yeah, so when you have a lack of blood flow to any part of the brain, on average, you're losing about 2 million neurons a minute. And out of the billions of neurons we have, that may not sound like a lot, but every single part of the brain, is necessary for us to function normally. So 2 million, 4 million, 6 million, that adds up fairly quickly.
Do you remember, Dr. Agarwal, looking back, anything that you were feeling the night before or even as you were brushing your teeth that morning that might have indicated something was wrong?
Absolutely nothing.
Nothing.
I was absolutely fine. In fact, I was in the hospital that morning for an outpatient appointment. I was in the clinic, and then after that I went for breakfast. So I was absolutely fine. If I would have had some kind of symptoms, I would have gone to the ER myself.
It's so interesting. You say you didn't think of a stroke. You're not the first medical person who's told us that. I just interviewed a nurse who was having a stroke and slurring her words, and she couldn't stand up. And in her mind, I think because the stroke is confusing you in that moment, she didn't, her mom was saying you're having a stroke, and this nurse was saying, no, I'm not. But she wasn't making any sense, but her mom was there and called 911. We do have some pictures of Michael McHugh's case to share with our viewers. He had a blockage in his left carotid artery. How long and big was that blockage, Dr. Abraham?
So you can see where that blue, the top blue arrow is pointing, where there's the contrast, a dark spot misses there. So that's about 5-6 millimeters, because we see the bottom of the clot and you don't really see where it ends. So it could end further down the top of that blue arrow there. So at least 5-6 millimeters.
What's the other blue arrow?
The blue arrow is just showing how tortuous his carotid artery is. Normally the carotid should be a fairly straight shot up, but for some reason, you know, due to genetics, his arteries were just super tortuous. So sometimes that can add a challenge in getting up to the clot, because if they're very tortuous, sometimes that tension will prevent us from getting our devices into the brain.
Did that affect it all?
Fortunately not. I was able to get my catheter around that turn and into the clot to literally suck it out.
That next image we were showing with the blue circle around it, if we can pull that up again, I wanted to ask you about that image. What have you circled there?
Yeah, so this is a side view. At the bottom of the screen, the larger dark line, that's his carotid artery, and then that blue arrow circling the area that should be filled with blood vessels or arteries.
And you don't see those because of the clot?
Correct, yeah. So that's a very large portion of the brain there on the left side.
We also have some side-by-side images that we want to put up, and I'd love for you to explain what we're looking at on the screen left and screen right.
Yeah, so now this is after the treatment. So the screen left, this is as if we're looking at Mike's brain. So it's the left side of his head. Now everything is fully filling inside of his brain. And the picture on the right is that side view where we showed earlier where there was where the arteries were missing. Now we see full filling of the left side of his brain.
There's blood flow.
Blood flow. Yeah.
And the final image we want to show our viewers, I'm looking at that, and I don't know what I'm looking at, but I'm told it's during the procedure.
Yeah, so if we can play the video, you can see, and I can see my wire going somewhat blindly through his carotid artery, and then quickly following that other device down there is called the aspiration catheter. So it's a catheter that has a very large lumen that we take literally to the face of the clot and suck it out of the brain.
Is that the little thing that looks like a little coil?
Correct, yeah, that's the wire going up, and then there's a slightly thicker object following right down there at the bottom of the curve. That's that catheter. And
you pull the clot out?
Correct, yeah. So I take all those things up to the clot, and then we attach it to something called an aspiration tank, which is a tank that provides continuous aspiration, and we slowly pull the catheter out.
And that was what you were able to do for Michael?
Correct, yeah.
Now, Dr. Agarwal, you underwent something called an emergency craniotomy. For people who aren't doctors and nurses, what's a craniotomy?
So craniotomy means surgery of the brain. Cranium is the skull, so where you open the skull. And the reason for my craniotomy is in the ER when I had my emergent CT scans. Those showed that I have a subarachnoid hemorrhage because of rupture of a small aneurysm in the left side of in the arteries of the left side of my brain. So that's the reason I had to undergo an emergent surgery to clip the aneurysm to stop the bleeding.
So they had to shave your head and open you up for a full brain surgery?
Surgery, yes.
Did you have time to be afraid, or were you feeling so out of it that you didn't know really what was happening?
I did not know what was happening, yes. So I have no recollection of when I was brought to the ER. I think I lost my sensorium or ability to recognize what's happening to me, to process things exactly right in the parking lot when I was in my car. I don't remember Brennan coming to me and calling 911, calling the hospital, or checking on me, or being in the ambulance, or seeing my colleagues in the ER when they were.
You've just been here for work.
Yes.
And now your colleagues are operating on you and
Yes.
treating you.
Yes.
After your stroke, Dr. Agarwal, you couldn't speak, you couldn't move your right arm, you couldn't move your right leg. You're a right-handed neurologist. I can't imagine how frustrating that must have been. When you woke up from surgery, what were your first thoughts?
So my first thoughts were, why am I in the patient's room, and why am I wearing a patient's gown, and why is my family in the room? The other thought was, why am I having trouble understanding everyone, and why am I having trouble speaking? And why is my right side of the body not moving? So all that made me realize that I'm not the patient here. I'm not the doctor here. I'm the patient.
You said you were having trouble understanding. So what was that like? Were people talking to you and you heard sounds but you couldn't process? What was happening?
So exactly like you said that, yes, I was hearing familiar sounds. Like I could hear my brother talking to me.
His voice.
Yes, his voice, or my colleagues who were my doctors, them coming to the room, checking on me, asking to smile, asking to try to move my arm. But I was not able to process that. I was not able to say that, okay, what does a smile mean, or what is my brother talking to me?
How did you communicate then?
So from what I remember, it was meaning like whatever I was saying. One, it was just a few words, and then again in aphasia, something we call as word salad. That whatever you are talking, you're not making any sense.
Aphasia? And
Yes.
we're going to get to that in a minute, because that was big. You had aphasia, and Michael had something called apraxia. But first, I want to ask you about the movement in your arm and your leg. How is that today?
So my leg, with all the intense physical therapy, has almost completely.
You can take a sip of your coffee if you want. That's why we
yeah.
have you all hydrated here. So your leg is almost totally better.
Yes, so the leg is almost better. I can walk independently. I don't use a cane or or any kind of assistive device. My speech, other than this cough or sore throat I have right now, I don't have aphasia anymore, or about 80 to 90% is better. But I have, unfortunately, my arm. I have pretty limited functional use of my right arm.
Your right arm.
Yes.
So you wear that brace to help. What does the brace help with?
So the brace is helping from my wrist to go down or be in a flexed position, and it's also keeping my thumb from going in.
From curling up.
Exactly.
So it keeps your muscles from contracting.
Yes.
I want to talk about apraxia versus aphasia. So Michael's stroke left him with something called apraxia of speech, which means that your brain struggles to plan the movement, your mouth needs to make the words form. How is that different, Dr. Abraham, versus what Dr. Agarwal had? She had aphasia, Michael had apraxia.
Correct, yeah. So aphasia affects the specific part of the brain that produces speech, kind of the thought process of producing speech, whereas apraxia, like you said, it's that motion, the muscles to create speech. That was his issue.
And did he have any movement issues, like loss of one of his limbs or his leg?
Originally, yes. You know, he was completely weak on the right side, but he quickly recovered that strength afterwards.
What usually recovers first, the speech or the movement?
It depends how severe either one of those beforehand, but we generally see the movement improve faster just because more of the therapies are directed towards motor movement and you know, being able to do specific activities, things like that.
What kind of therapies helped you the most, Dr. Agarwal?
So I had it all, like physical therapy, speech therapy, and then occupational therapy for the upper extremity. I think in my case, the physical therapy, the therapy on my leg, that helped me the most.
And what about your speech? How long did it take for that to come back?
So I think it was gradual, of course, but I could speak in the first 3-4 months, but not fluently. And about 6 months or later, I was definitely like talking more. And overall, I would say probably like to get my speech back to where I am currently, it took about 1.5 years.
And now your leg is good, your speech is perfect. I keep thinking about what that must have been like to open your eyes and you're processing so many things, being the patient, not the doctor, you're surrounded by family, but I feel like the most upsetting thing would be to see your relatives and hear them talking but not understand their words.
Yes.
I would have just started crying, I think, out of fear. I would have been afraid. Did you know at that point I had a stroke?
In retrospect, I think that I realized then, but then
Right.
I have no recollection of the first 15 to 20 days. So
my
I don't know
gosh.
if I did recognize that I have a stroke.
Thank God you're okay. We have so many questions and comments coming in. If you have a question for us or a comment that you'd like us to read out loud on the program, you can send it to us right now in the chat portion on YouTube or Facebook, whichever platform you're using to watch us live right now. We have the links right there on your screen. Dr. Abraham, did Michael have any type of risk factors that would have led to the stroke?
Yes, so as we said earlier, we knew Mike had or has atrial fibrillation, where there's discoordination of the pumping of the heart chambers. And
Did he know he had AFib ahead of time?
Yes.
Okay.
Yeah.
And so that was his big risk factor.
That's what it is, yeah. And that's probably one of the most common causes of stroke that we see is atrial fibrillation.
And on the show we air on Thursdays, All Things Heart, we have a lot of people with AFib, and that's the reason they're worried about it, and they get it treated because they're worried it will cause a stroke.
Correct.
Dr. Agarwal, did you have any risk factors that you knew of ahead of time?
No, I didn't have any risk factors. I mean, the common risk factors you look for is high blood pressure, diabetes, high cholesterol, or any heart abnormalities. I did not had any of those. So that's why the differential diagnosis of a stroke did not occur to my mind initially.
How large or small of a portion of your patients have no risk factors?
A much smaller percent, probably a quarter, 25%.
So Dr. Agarwal's in the small.
Yeah.
She's special. We always knew she was a special person, but unfortunately your stroke was the kind of stroke that was not common then.
Yes.
Correct.
Do you have any idea what caused it?
So it was a aneurysm.
Yeah.
So aneurysm is an abnormal dilatation, like a balloon-like dilatation of a blood vessel in the brain. But then, surprisingly, my aneurysm was so small. It was like about 2 to 3 millimeters in size. So that is like even smaller than a pea.
Yeah, like
So,
a tiny little.
Exactly.
Yeah.
So, I mean, usually this size aneurysm, even if I knew I had an aneurysm, and I would have probably seen Dr. Abraham for that, there is no treatment indicated. Like, you just watch it.
What was your specialty? What is your specialty as a neurologist?
So before the stroke, I was a neurophysiologist. I was doing a lot of EMGs and all, but now I cannot do that. So I'm a general neurologist. I do a lot of clinic, and then I do intraoperative monitoring.
It must be very comforting for people to come in with a problem and know and see how successful you are and how you've come back from this. I think that would be very comforting as a patient.
Well, I think yes, and for me also, I think living with a stroke has given me a unique insight of experiencing what our patients go through, not just physically, but then emotionally, socially. So I can just connect to them better.
Absolutely, and that's why you created this amazing group. This is on top of everything else Dr. Agarwal does. She also created a stroke survivor support group. How can people join that?
So the information of the stroke support group can be found on, if someone looks up Kansas Health System Stroke Resources, that will take you to a web page which has a lot of stroke resources, and it has the information for our stroke resource and stroke support group. And I think, in my opinion, the stroke support group is an essential component for a stroke survivor or a caregiver. It is an area which makes them feel that they are not alone. And so the information can be found there, and as it was just shown in the flyer. And we meet every third Wednesday of the month in the evening from 6 to 7:30, both virtually and in person.
That's such a great thing that you're doing. We do have some community questions and comments that I want to get to right away with the time we have left. Marcia writes, wow, thank goodness Dr. Agarwal is okay. Since this experience, has it changed how she works with her patients? And will the use of her arm or hand continue to improve?
So I am currently engaged in therapy, so I hope that yes, there'll be some improvement in my arm. And this is, again, it's one of my favorite tagline now, that the stroke recovery does not have an expiration date. So even if, like, I am almost 7 years out of my stroke, and I'm still continuing to do therapies, and I can see an improvement, although it's now a slow curve or slow improvement, but it is still improving.
You just got to keep going.
Exactly.
Jill wants to know if there's lingering pain, headaches, or other discomfort after a stroke.
So in my case, yes, I do not have any headaches. Pain probably is due to muscle stiffness and the stretches or the exercises I perform. I do the exercises, but then that pain is necessary because if I don't stretch or don't exercise the arms and legs, then they will become more stiff, and obviously they'll not recover. But otherwise, yes, I do not have any pain.
Dr. Abraham, Becca wants to know, how do you know when you need to do surgery or when you can use a clot-busting drug or other things?
So a lot of the times it's actually both. The clot-busting drug, known as TNK or tenecteplase, is still the first line of treatment within 4.5 hours. So that if a patient is a candidate for that, then they will get TNK. And then if they have a large blocked artery in the brain, then we'll take them for surgery to pull out the clot as well.
We are so glad to have you here as our guest and have you doing so well. And Dr. Abraham, we're lucky to have you here at the health system. As we wrap up this discussion, for today's takeaways, I'll start with Dr. Agarwal. What do you want viewers watching to know?
So my biggest message would be that stroke is preventable, treatable, and beatable. So if you are a stroke survivor or a caregiver, don't give up, never lose hope, and keep fighting.
Keep fighting. Dr. Abraham, what would your message to our viewers be?
To echo what Dr. Agarwal said, it's preventable. I think, having a good PCP to monitor for any risk factors is a great way to prevent stroke and other diseases as well, like heart attacks and things. So I think maintaining a good PCP relationship, routine labs, and health preventive measures are good.
How much do you see emotional support helping patients, like the kind that Dr. Agarwal is providing to stroke survivors?
Yeah, she's a great inspiration for our stroke patients. And in clinic, I will hand out the flyers for her group out to all my patients. So, having somebody like her leading that is such a great emotional support for our patients.
We have one more comment from Kim Bosley Moore. She writes, sending many prayers to Dr. Agarwal. Oh, and I see 3 little dots popping up. It means someone else is typing a comment. So hold on, we gotta be patient. We have Jenny saying, Dr. Agarwal is the strongest person I know.
Oh, thank
That
you.
is such a great thing. And then we do have a link to stroke resources on our website. So we've posted that comment to our thread as well, that links to your support group.
Thank you.
Thank you so much for joining us. And are you going back to your full day of work now?
Oh, yes.
Back to your full-time gig.
Yeah.
And then you've got your support group. And then you've just got a life to lead. So we appreciate you. Dr. Abraham, thank you so much.
Thanks for having us.
And thanks to our guests for joining the conversation. Coming up tomorrow on Open Mics with Dr. Stites, we explore the life-saving treatment of CAR T-cell therapy. Dr. Stites and his experts will help explain why more patients may qualify for this treatment because of all the scientific progress being made.